Welcome everyone to the Canadian Sleep Research Consortium Sleep Education webinar series. It's a pleasure today to have this session on sleep health, what works well for your family. So my name is Rebecca Robillard. I'm the co-chair of the Canadian Sleep Research Consortium, and I'll have the pleasure of moderating the session today. I'll just advise everyone that this webinar is being recorded. The recording will be available on the Sleep Consortium's website and our YouTube channel shortly after this presentation. So it's a great pleasure and honor to introduce today's speaker, Dr. Marie-Hélène Penestri, who will give a 35 to 40 minutes presentation that will be followed by a Q&A session at the end. So Dr. Marie-Hélène Penestri is an associate professor at the Department of Educational and Counseling Psychology, and also the Associate Dean of Research and Innovation at the Faculty of Education at McGill University. She's also a regular researcher at the Integrated University Health and Social Services Centers of the Nord de l'Île de Montréal, le CIUS NIM. She's the director of the Pediatric Sleep Laboratory Once Upon a Night. Dr. Penestri's research program aims to investigate the development of sleep-wake cycles in infants, children, and adolescents from a developmental, but also from a family perspective. She's also investigating associations between sleep and mental health in vulnerable populations. Dr. Penestri holds grants across all three Canadian councils, CIHR, SSHRC, and NSERC, as well as a William Dawson Scholar. She's a William Dawson Scholar at McGill. She has an internal chair, and she's also Chercheur Boursier Junior 2. In addition, Dr. Penestri is a clinical psychologist working with children, adolescents, and their families at the Pediatric Sleep Clinic at l'Hôpital en Santé Mentale Rivière-des-Prairies. She's actively involved in her community and in activities that facilitate knowledge transfer. Dr. Penestri's research questions are drawn from her experience as a clinician and as a mother. So without any further ado, my dear friend, Marie-Hélène, if you want to start this important presentation today.
Thank you very much. Thank you, Rebecca. The last section was the most important one. I'm glad to be here with my friend Rebecca. Thanks for this great invitation. I'll stop talking 2 seconds because I'm not able to share and talk at the same time. So can you confirm I was successful in the operation? Thank you. Thanks for that nice presentation. So I'm glad to be here today. We're going to talk about sleep for sure, but in a family context. And Rebecca just said it. I'll talk as a researcher, but also as a clinician, as a mother, and as a friend. I hope that all together we can think about what works well for each of us, because it's not necessarily that one thing will be the best scenario for all families. So let's start slowly, and I hope it works well. Do not hesitate to interrupt me if there is any problem. So we'll start with a story. We'll start slowly. Once upon a time, there was a PhD student involved in sleep research, and she was also a psychologist. And she was reading, writing papers about sleep, and she thought somehow she had knowledge about sleep. And then one day, the researcher had a baby, and she had the second baby, and all of a sudden she realized that the knowledge she had from reading and from writing was not necessarily aligned with the reality. So that's my story, in case you didn't realize yet. I think there's sometimes a shock and a disconnection between what we expect, what we read, what we learn, and what actually happens. So I think we're all aware, I hope. If not, let's start with that, there are several impacts of sleep disturbances, meaning not sleeping enough or having sleep disturbances. We know that there are impacts on mental health and there are impacts on physical health. And this is bidirectional association. So if we have issues with, oh, it stopped sharing, did it?
Yes, I'm so sorry. That's my bad.
Okay, no
You should be able
worries.
to
You're
share
my
again.
friend, as we said, so no worries with that. Do you see the slides now? I'll just...
Yes, all good.
Okay, all good. No worries. It's just to see if I was attentive, right? I am. We'll see. Okay, so there are impacts, as I said, on physical and mental health and vice versa. If we have issues with our mental health, with our physical health, it's also going to have an impact on our sleep. These impacts are short term. We all know, we hear things like, oh, I had a bad night of sleep yesterday. I do not function well today, but there are also long-term impacts of sleep deprivation and sleep disturbances. That, I think we hear it more and more, and I surely hope that it is something we're more knowledgeable about. The thing we hear maybe less often is that, yes, sleep is a biological process, but it's also a relational aspect. Okay, so there's a really important social and relational component to sleep. If you think about it, in your own family, if your partner, if your child has a sleep problem, it will likely impact the other members of the family, right? It could disturb your own sleep. If one of the children has a sleep problem, it could impact the sleep of the other children in the house. It could also lead to interpersonal conflicts. For instance, maybe the parents do not have the intention of treating or not treating the problem the same way. Okay, so that's just an example, but let's keep in mind that there are also social components related to sleep. So don't worry, I will not go into details here, but I think it's an interesting model to illustrate what we're saying. First of all, when we're talking about sleep health, important to keep in mind that we're not strictly referring to the absence of sleep disorders, right? Sleep health is much more than that. We're talking about timing, efficiency. So it's not only a question of duration. There are a lot of factors involved. Also, yes, as we said, there is, I don't know if you see the mouse when I move, but there are elements related to biology or to individual components, age, temperament, genetic profile, but there are also elements related to parent-child interactions or socioeconomic status, right? There's a context, and if we go even larger, the system in which we live, right? Is there a lot of noise, of light, violence, how safe it is to fall asleep at night? So these are all factors that we should consider as well. So when I was asked to do this talk, I started thinking about a title, and that what comes to my mind, what works well for my family, because as we said, it might be different for different families. I don't know if you read sometimes a book or on the internet, you're gonna find a lot of information, and sometimes people are wondering, well, you know, what I do in my family or what I'd like to do is different from what I read. What we're doing in my family, it's different than what I see in other families, my friends, my sister, my cousin. We're having different practices. Who's right? Who's wrong? So what's the right answer? And I feel that parenting today is challenging because we're always trying to find the right answer. What is the right thing to do? And sometimes information is contradictory. So I think that if there's one thing I'd like you to remember after this talk, it's, well, it's not necessarily that there's only one way to do things when it comes to sleep. And I'll just add another layer: transition to parenthood. So becoming a parent, it's a sensitive period of life. It's a beautiful and joyful moment. But let's keep in mind that it's also a very big change, right? You're learning a new role, and your other responsibilities, they do not disappear, right? You're just having new ones. So it's challenging. You're learning your new role. And on top of that, you also face sleep deprivation, because guess what? Your infant will not have the same sleep-wake patterns than you. Okay, so yes, there's the sleep challenge, but it's on top of other many important challenges. So that's how we're gonna talk about it today. I prepared 8 questions, and as I said, we're gonna try to answer these questions, and I'm gonna talk to you, as I said, as a researcher, as a clinician, as a mother, and as a friend. And I hope we're gonna have time to answer some questions. If you have some questions during the talk, do not hesitate to maybe note them so that you can remember them at the end of the talk. First question, and if you saw me presenting before, you know this is something I really like to talk about. So first question: at what age should an infant sleep through the night? And it's not an easy one. So I'll say that again. I said it before. If you're trying to think of what's the first thing you say when you meet a new parent, usually the first thing you say is like, "Oh, what a beautiful baby." But then most of the time, what comes next? Take a few seconds to think about it. Well, most of the time, the next question is, "Oh, are they sleeping through the night?" So think about this parent who is asked this question again and again and again by health professionals, by friends, by neighbors, by family members. At some point, it gives the impression, well, it looks like a very important task that I should be able to achieve as soon as possible. Remember, we're already in a sensitive and vulnerable period of life. So, first question: what does it mean sleeping through the night? Depending on different authors, sometimes we're talking about 6 hours of consecutive sleep, meaning no awakenings during this period, or no signaling, right? I'm already adding another layer. It could be 8 hours of consecutive sleep. Sometimes it refers to a specific period of time between midnight, 6 a.m., for instance. But most of the time, when we're talking about sleeping through the night, we're talking about a consecutive period of time, as opposed to total sleep duration during the night. However, it does not mean that everyone has this definition in mind. So it's very possible that when you're talking to someone else and you say, "Oh, is your infant sleeping through the night?" maybe you don't have the same definition in mind. So important to keep that first thing in mind. So when should it happen? There's this really interesting review that looked at several studies, and Of course, you just said that there are different definitions, but on top of that, there are different ways to measure sleep, right? Actigraphy, polysomnography, parental self-report. So I will not go into details here. It would take way too much time. But if we take in general in the different studies in this review, what they showed is that at 1 month, looking at all the studies, there were between 0 and 57% of infants sleeping through the night. At 5 months, it was between 29 and 77%. And at 12 months, at 1 year old, it was between 40 and 87. So I think we can all see that, well, there's an increase, right? A slight increase at each time point. But I hope we also see this huge range, this huge variability. So I'm not sure how useful it is to know that at 12 months old, there are between 40 and 87% of infants sleeping through the night, right? For me, it says, well, there's a lot of variability between different infants. So with my team, and I put the QR codes here if ever you're interested in looking more into the different studies we're talking about. So we looked in the cohort, with the MAVEN cohort, at approximately a little more than 300 infants. So here we're talking about maternal reports, and we looked at the consecutive sleep time, and we used different criteria to see if mothers were reporting that their infant was or was not sleeping through the night. So this is a typically developing cohort of infants. So at 6 months, using the criterion of 6 hours of consecutive sleep, so yes or no, as reported by the mother, we had about 2/3 of mothers reporting yes, and 1/3 of mothers reporting no. So this is a result, right? Now, how do we interpret it? I can definitely say, well, most infants were sleeping through the night at 6 months. That would be true. But I could also conclude, well, at 6 months, in a typically developing cohort of infants, we have 1/3 of infants not sleeping through the night. So before telling 1/3 of families that there's something wrong, I would be careful, right? If we look at 12 months, still 1/4 doesn't sleep through the night. Of course, if we're using a criterion of 8 hours of consecutive sleep, then the proportion gets even higher for those who do not sleep through the night. So let's just look at all this red and keep in mind that these infants were not sleeping through the night. So I feel these numbers are important because somehow there's this idea that at 6 months, most infants are sleeping through the night. This is something we hear a lot. Okay, so question 2. You know what? Yesterday, my baby slept through the night, and I'm wondering if I should expect this behavior to occur every night now. So if you're a parent, I probably hear you laughing right now because you probably know the answer already. This is a study I did a few years ago, and I was talking earlier about my shock when I became a mother, when I compared my experience to what I've learned. And I was reading the literature, and I would see things like, studies asking in which mothers were asked, in general, is your infant sleeping through the night? Or in the last week, or in the last 2 weeks, was your infant sleeping through the night? And I kept thinking, well, I don't even know what I would answer because it's so different from one night to another. And I was just concerned about like how come how come we don't talk a lot about that. So that's what we did, and this is quite a small sample size. This is a really highly educated with high socioeconomic status sample. So I'm really not pretending here that it's representative, but I think we can talk about this internight variability within the cohort. So at 6 months, we asked mothers with my great team of students to complete sleep diary for 2 weeks. So that's what it looks like. So every morning, the mother would just, complete. And when it's black, it means the infant is sleeping. When it's white, it means the infant was awake, and did it that for every day, every night. So just to show you how we did it. And then again, I'm very grateful to my wonderful team, because you can imagine I cannot do all that alone, and it took some time. So let's say for this night, we had at least 6 hours of consecutive sleep, so we would score it as a yes. The night after, right there is a consecutive period of sleep, but we never get to this 6 consecutive hours, so that would be a no. Again, almost, but it was a no. And we did that for every night. Again, the QR code if you're interested to learn more. So what did we find? We did that for every night, for every family. So if we look at the average, okay, a mean, we did that for 2 weeks. So we had 13 nights. In average, mothers were reporting that their infant was sleeping through the night approximately 5 nights out of the 2-week period. Okay, so a little less than half the study period. But this is a mean, and what I was interested in was the variability. So let me guide you a bit here. I know there's a lot of information. Hopefully you can see my mouse, but I'm not sure. So these are the 13 nights, and these are the 44 families. When it's white, it means the infant was not sleeping 6 hours consecutively. And when it's gray, it means that the infant was sleeping 6 hours consecutively as reported by the mother. So what do we see? There were 9 mothers reporting that their infant never slept through the night during this 2-week period. And there were 3, lucky of them, that they reported that their infant was sleeping through the night every night. But most of them, as you can see here, we can see much variability. So if we take one, just by like that, it would be no, no, yes, no, yes, no, yes, no. So when it happens, on that specific date, I think it's important that parents are aware that, well, it's not because it happened one time that it's going to necessarily happen every night on after. Okay. So I think this is important first clinically, or as a friend, as a neighbor, as a sister, to explain that to parents. Okay. That it's not something you check, right? That it's not a yes or no. Now my infant is able to sleep through the night. There's going to be fluctuation, and it's not necessarily abnormal, and we should not be worried about that. And it's also important methodologically, because all these large epidemiological studies, they're using means, they're not necessarily looking at this night to night variability. So I think it's important to keep that in mind. Okay. Third question. Now, are parents sleeping through the night? I don't know if you're familiar with some similar situations. No surprise. When we look at the sleep of parents just after pregnancy, and here it was quite a large cohort. This is a quite recent paper by a really great team. And of course, no surprise, we see a decline after pregnancy. When the infant is there, there's a decline. This is measured here both by sleep diary and by actigraphy. And we have the line with the father, and we have the dots with the mother. We see that it's more marked in mothers, and we see that eventually it comes back, but not quite to the initial level. And there are other studies I did not present today, but showing that even after a few years, unfortunately, I don't want you to be too afraid, but it does not go back to the initial level usually. A few words here to say that it's quite exciting. The field is moving forward. We have more and more fathers involved in pediatric sleep studies. There was a time where we would only see mothers, so that's great. And slowly we're even trying to move a bit more, and I hope to maybe come back next year maybe and talk about other studies looking at non-traditional families to reflect families as we see them today, so that it's not based on, you know, a mother and a father necessarily. So looking at single parenthood, same-sex parents, families, and so on. Okay, so let's keep that in mind in sleep and in developmental research in general. That's another study one of my recently graduated student, Christopher, did, looking at this variability and sleeping through the night, this time in parents. So a similar methodology. Here we have 10 nights in mothers and fathers, and we had 33, families. So again, in white, so now that's quite interesting to have that as a vocabulary for parents. So in white, parents were not sleeping through the night, and in gray, they were. So just at a glance, I think we can see a difference between mothers and fathers. To their defense, I must say that most of these families, mothers were on maternity leave and fathers were back to work. So probably there was an arrangement that mothers would take care more of the children during the night. But we assume, right, it was not necessarily measured. So that's something we should look at more in the future. And again, the variability is present. Okay, looking at the time. So I'm going to try to continue for at about 15 minutes, and then we can have discussion and questions. Okay. So question 4, am I the only one with questions about infant sleep? We said it earlier, when, especially, you know, when you're on parental leave, you're at home most of the time alone with your infant, you have all these questions. You're unsure if you're doing the right thing. Should you do things differently? It can be quite challenging. So unsurprisingly, sleep concerns are documented to be one of the most common reasons for a medical consultation during the perinatal period. Okay, so parents ask a lot of questions, and unfortunately, professionals are not always trained well to answer these questions. I'm sure if you Google infant sleep, you're gonna find a lot of information. So the problem is not that there's no information. There's a lot. You'll find advice. The problem is that it's not consistent, and I would even say that it's often highly contradictory. So imagine you're in a difficult moment, you're trying to find information, and you find almost everything, right? A few examples, right? So I read that it's important to share a room, but not co-sleeping. What's the difference between the two? And is it okay? Is it dangerous? I read positive and negative elements about that. I enjoy so much rocking my baby, but I read that I shouldn't do that. It's a really bad habit, but I enjoy it, so I'll do it, and I will just not talk about it so that my pediatrician doesn't know, right? So I will not say it. And then I want to try the cry it out method, but I've learned, I've read it could be dangerous, or I don't want to do it. But the nurse told me I had to do it. Do I really have to do it? Again, other types of sleep training. I'm comfortable, my partner is not. We argue all the time about that. At what age should the infant sleep through the night? And I heard different definitions. Should I breastfeed? I heard that breastfeeding is good for my baby's health, but I also read that breastfeeding is fragmenting sleep. So you see that it's very difficult to try to read and integrate all this information, okay? And there could be more. I could have probably spent several minutes of this talk with different examples. So we're talking about the internet, and it's been some years now, but there was this interesting study in the US looking at all professional books on sleep, and then on very, day-to-day important topics for new parents. If you look at the crying out, there were 61% of the books endorsing it, and 1/3 were opposed to it. About co-sleeping, again, you can see that there's much variation. So no wonder why it's really confusing for the parents. So we should probably do something similar today, trying to capture all the information we can find on the internet, but probably we would get to similar variations between different sources. Okay, question 5. Are all families the same when it comes to sleep? I think I'm starting to explain and to answer this question since the beginning of the talk. So, of course, we're in North America, so our natural reflex is to think about sleep as we learned about it, and as we hear people talk about it around us. Okay, so when we think about night awakenings in infants and children, I think our reflex is to consider that as a problem, right? And sadly, there are studies talking about, sleep disorders in, 3-4 months old infants. It's a developmental process, right? So it's not necessarily a sleep disorder to wake up. So it's important to keep in mind, and I think we have to force ourselves to think twice, right? That expectations, parental practices, it's true for sleep, it's true for a lot of different things, that they can vary as a function of the culture, of the different values. So it's not that all parents are necessarily aiming for rapid sleep consolidation. And we know that specific subgroups, so we're talking about cultures, but we're talking also about values. So especially parents practicing co-sleeping or long-term breastfeeding, they in qualitative studies, they explain that, well, it's not their objective. So they're really confused when they're asked again and again and again, oh, is your infant sleeping through the night? They just don't understand why there's this question again and again. And at some point, it's not rare to see parents just, not really answering because they don't want to feel judged about the fact that their infant is not necessarily sleeping through the night. So this is an example I like to give. Let's say you're a parent and you have a 3-month-old infant, okay? And the infant is now 6 months old, and you're it's 2 a.m. to 3 a.m. in the morning. Your baby wakes up and cries. You go, you in the room, get the baby, and today you had an appointment with your pediatrician or a nurse or another health professional, and you talked about sleep, and you were asked, well, oh, your infant is not sleeping through the night. So not only, of course, you're tired, you're maybe probably vulnerable at 2 a.m. in the morning, and it's probably one night among several other nights. But on top of that, if you think that it's not normal, maybe you're mad at yourself. Maybe you're thinking, well, there's probably something I do wrong. Like, how come I'm not able to achieve that? Maybe you're sad. Maybe you're depressed. Maybe you're anxious because you don't know what you're doing wrong. You could be also mad at this infant who's not sleeping through the night and should be. And all that is happening in a moment where you're creating this relationship between you and your infant, right? If in another scenario, maybe you attended this talk today and you heard that, well, it happens more than we think. A lot of infants are not necessarily sleeping through the night. That's 6 months. So same scenario here. It's 2, 3 a.m. in the morning. You wake up, the baby's crying. You're sleep deprived. You are still maybe vulnerable and maybe sad or depressed, but you don't think that there's something wrong. And that only that can change the way you interpret the situation, right? Because you don't need this unnecessary layer of pressure of like, there's something wrong, I'm not good, there's something wrong in my family. So let's try to keep that in mind when we talk to new parents. Okay, don't worry, the last questions will not take that much time, so we'll keep time for questions. Next question. Every child needs the same sleep duration. So now we're not necessarily talking about infants, but children, even teenagers and adults. Because as a clinician, that's a question I often I'm asked often, like how much time should my child sleep? So you're maybe familiar with these recommendations from the National Sleep Foundation. What I like is we can clearly see the evolution, right? That it changes throughout time. But we also see that there's quite a range, right? In blue, we have what's recommended. So let's say for a toddler, it would be between 11 and 14. For a preschooler, it would be between 10 and 13. But we also have a zone in turquoise showing that it could sometimes be necessary to have a little more. And for some children or adults, sometimes it's enough to have a little less. So big question is, how do we know? Should we buy expensive tracking wearables? Should we buy cameras to really look at what's happening in the night? The answer is much more simple. And it's true for yourself as well as an adult. I think we need to be honest with ourselves. And instead of looking at our watch or the clock, we should look at our child and see how they're doing during the day, right? Are they falling asleep in front of the television or in the car? Are they somnolent? And let's be careful, because in children, it's not necessarily that you're going to fall asleep or be somnolent when you're sleep deprived. It could be as well that you're way activated and showing difficulties in behaviors or emotion regulation. So it's possible that your child needs a lot of hours of sleep, and it's possible that they need less. It's important to be aware of that and to look at them. Once you identify how much time is necessary, and it's true for yourself as well, unfortunately, there's nothing magical we can do about that. That's a biological need, and we cannot train ourselves to need more or less sleep. And last question, because this is also something I'm asked all the time at the sleep clinic. There's this idea of an earlier bedtime is better for sleep health. We used to hear sleep before midnight is better sleep. We hear these things. It's probably based on the fact, so the answer is not necessarily, it's probably based on the fact that when we fall asleep, there are different sleep stages throughout the night. In the first moments when we sleep, we have more slow wave sleep, which is associated with growth, with rest. So this stage of sleep is really important, but it's going to happen first, no matter at what time you're going to fall asleep. Okay, so that's probably where it comes from. So the real question is, at what time you have to wake up your child in the morning? Okay, so that's what's going to guide your routine, right? So at what time you need to go to be at the daycare, at school, or maybe it's because you need to be at work at a certain time. So if you have to wake up all the family members at 6 o'clock, your bedtime will not be the same as if you live just in front of the school. You can wake up your child at 7:45, then you can have a later bedtime. Okay, so there's no perfect answer. What's important to keep in mind is that we're talking about duration, but regularity is also important, right? So we're trying not to have too much difference between weekdays and weekends, because it creates a lag for your circadian rhythms, and your internal clock will not know at what time to fall asleep and to wake up in the morning. So last question, very fast. We'll have time for questions. Where can I find some resources? So you can take a picture or watch back the video. I included here a few resources if you want to have more information. And on several of these websites, you will have different informations with a developmental approach, depending of the age. So that could be quite interesting. And before answering questions, I cannot end without being so grateful to my wonderful team. Again, they helped me finding some pictures and information for this presentation. So all my graduate students, my coordinators, the families participating to our studies, right? They have a newborn at home and still they find a time to participate with us. And I think they're happy to contribute. They want to know more about their sleep, their infant sleep. So usually families are greatly interested. So a few pictures of this more than wonderful team. I'm the luckiest. I like to say that I'm the luckiest researcher in the world with this great team. If you want to have more information on our team, please visit our website. We have a French and an English version of our website. And don't forget that tomorrow is a very important day. I don't know if Rebecca has other information to give us, but I think there are quite really exciting activities starting tomorrow for the week for better sleep. Thank you.
Excellent. Thanks so much, Marie-Hélène, for this excellent presentation. I think it really helps put things in perspectives for parents and everybody who's, in relation with parents and children. So thank you so much. I guess I will open up the session for questions and comments. So I'll invite people, and we're a fairly small group. If people want to also just open up their camera and unmute and ask their questions live, or if you prefer, you can also just write your question in the Q&A box or in the chat box. And perhaps maybe I get started while people are still reflecting on their questions. I guess you touched on so many different factors that are important to consider, Marie-Hélène. It's quite a complex world. I'm kind of curious to hear your thoughts more about the kind of how all of this is kind of intertwined with some changes in perhaps in sleep architecture as people the little ones are getting older.
Yeah, so you're referring to how, like, the developmental piece of it. Yeah, so yeah,
So-
we talked more about like infancy, but it's highly fast evolving world. Sleep, at a few days, few weeks, and months, and then at 2 years old, 4 years old, like it goes so fast, and you see it. It's not only about sleep, right? When you look at a child, and we say that, like, oh, I didn't see him for 6 months, and it feels like a different child, right? Because brain maturation changes everything. I didn't touch that, but one good example would be the naps, right? It's gonna change totally the architecture of sleep, right? Because at the beginning, you're going to have 2 naps, probably, or more during the day, eventually 2, and then 1. And then this is a whole topic we can have a conference on. But when and how should we stop napping? Because sometimes you're going to, steal a little bit of nocturnal sleep if you want to continue the daytime sleep. And then sometimes, we see parents coming for a sleep disorder, right? My child doesn't fall asleep at night. And we realize that, well, it's just because they were still a nap that's not needed, right? So it creates the impression of there's a difficulty to fall asleep, and conflicts. I'm sure some parents can relate here. And then we just advise to have a shorter nap, or to just remove it, and then it solves the problem. So there would be more examples, but
Yeah, and I feel like we should have a whole other session on napping
yeah.
per se, yes. Thank you. So I see Elise is asking les différences au niveau des durées de sommeil chez les même chez le bébé corrèlent avec les poussées de croissance. Donc, are differences in terms of the length of sleep, even in babies, correlated with growth, like how do we say that in English? Like growth crisis.
Yeah, I'm not sure.
When the little ones are getting bigger.
Yeah. But that's really interesting, because we hear things like, oh, when I was talking about this variability, we hear like stories like, oh, she was able to sleep through the night, there was no problem, and all of a sudden it starts again. And sometimes it's associated with, as Elise just said, with, oh, there's an, I'm searching for the word as well. So they're growing all of a sudden, or they're starting to crawl or to walk, like if there's something happening in a developmental step that's taking energy or influencing. So, and there it could be just about a vaccine or teething, but it could be as well into brain maturation processes. So we see these fluctuations. Yes.
So a lot of things happening
Yeah,
at
and
sleep.
related to breastfeeding as well, or just to feeding, no matter what type. But when you're hungry, you're gonna wake up, right? So you're right. It's all intricate.
Right, excellent. I'm looking in the
Yeah.
chat box and the Q&A. Are there any other questions live for Dr. Penestri? Yes, Dr. Huon.
Yes, hi. I just really am happy that you put this together. It would be really great as a pamphlet to be able to give out, because this is managing expectations. People are always, comparing themselves with other families, and always seem to, the default is that there's something wrong with me as a mom. And so this is really good to dispel any of that. So you can just get on to the next page and talk about function in your relationship with your baby. So I really appreciate your presentation. Thank you.
Thank you. That was a pleasure. And I touched a little bit on that, but yes, there's a whole field of research on perceptions, expectations. So I'd be happy to come back and talk more about that.
And I guess just quickly, Marie-Hélène, that probably has a lot of to do as well in terms of vicarious learning and what might be translated from, the preoccupations of the parents that might not always be necessary, or that might come from external causes,
Yeah.
and the relationship that kids might grow up to have with their sleep. Is that something that you've touched on?
You mean the fact that we have this idea of how it should be, right? And
The expectations,
yeah,
yeah.
yeah. I mean, I've been through that myself. You think you're a sleep researcher, it should work well, right? And you realize, well, it can and it cannot. And interestingly, it has been shown that since we're not, trained enough on that field, that often health professionals are advising based on their own experience, which sometimes will match the family they have in front of them, but sometimes not, right? So I think it's important to put ourselves in the perspective where you say, well, it might be that this family has the same values and objective than me or not. So my first question when I work in the family is what's your objective, right? What do you want to work on? I don't start with an idea of, oh, they see that as a problem, they want to solve that, because it might be, or it might be completely different.
Yeah. Okay, great. And I see some comments in the chat as well, in terms of, grandparents sometimes with more experience, and then the parents as well. So
Yeah.
there's a whole intergenerational perspective as well, I
Yeah.
guess.
Yeah, that would be interesting. We could add another generation.
Excellent. So, okay, if there's unless there's any questions from the from the members of the audience. Otherwise, I'm seeing a lot of thank yous and a lot
Thank
of
you.
people finding that the talk was really informative and helpful. And I guess I'll remind people as well that, yes, we do have starting tomorrow, the Week for Better Sleep, which is this initiative where people can sign up to receive daily sleep tips. So it's encouraging people to think about their sleep and do, implement thank you, Marie-Hélène, to implement some evidence-based practice that have been put together by a committee formed by the Canadian Sleep Research Consortium to really change behaviors and thoughts and things that we can do, not just during sleep, but also during the daytime to get better sleep. So people can sign up on our website at researchsleep.ca, and I'll encourage the whole community to share that news as well through social media. We've got lots of posts that you can reshare through your channels.